How's it going, everybody? New England veteran. And today we are talking with Kyle Toto. Thank you for being here, Kyle.
Thanks for having me, Paul.
And today we're talking about 12 myths about VA healthcare. Can you give us a little reference as to how these came about, the 12 myths about VA healthcare?
Yeah, so our team at VA New England Healthcare, we do outreach events throughout the year. We do hundreds of them. So we talk to the public all the time. So big events like NASCAR and Bike Week, things like that. People come up to us, veterans or the public alike, and these are things we've heard from being on the streets. So we've narrowed it down to 12 kind of misconceptions that we've run into, and we try to let people know about those so that we can tell them the real information.
Cool. And so the first myth about VA healthcare we have here is you must have seen combat to be classified as a veteran.
Yeah, this is a big one that we get. I think part of it is the military mentality. Maybe things that people have heard when they were in the service. A lot of people think that they have had to have been a trigger puller to be eligible for VA healthcare. We get that a lot too, with people that think that you had to have been wounded in war to be eligible for VA healthcare, and quite frankly, neither are true. Of course, we prioritize veterans, and those sort of veterans would get VA healthcare, but we have a lot of veterans like those that served at Camp Lejeune from 1953 to 1987. As long as they were at Camp Lejeune for 30 days, they're eligible for VA healthcare. VA will also look and see if you have a service-connected disability. And those things can come from just twisting your ankle in PT. It doesn't have to have been something that, no, really, as long as you were on active duty service when the injury occurred, that makes you eligible for VA healthcare. So, you could have been supporting the mission, but in a different part of the country and not in the war, it still makes you eligible for VA healthcare. Of course, they look at things like income eligibility as well. So there are a lot of different factors that go into it. And it's not just exclusive to if you were a wartime veteran or in a war.
So each veteran's circumstance is very unique to themselves, really.
It is, yeah.
And the second myth about VA healthcare is I'm okay, so by using the VA system, I am taking services away from another veteran. What does that mean?
Yeah, I think this goes to the military mindset. When we're trained in the military to think about the other people on your team or the other people in your platoon. So everyone kind of has this mentality of, I got to look out for the other people. So they bring that mentality to being a veteran, and hey, I got to make sure that the VA is there for those that are very severely wounded from combat or something like that, which is a great idea, and it's something that we all know, and we all selfless service was a big deal to all of us. So people bring that mentality, but as veterans, it's a little different. And the other thing I think that we see is a lot of veterans that you just took some Tylenol and water and walked it off and you were good, right?
Right.
So I think a lot of us still hold that sort of mentality of, I'm all right, I don't need it, save it for someone else. But the reality of it is it actually helps your fellow veterans. If you come to the VA, even if you're just using the VA for one primary care appointment a year, that shows numbers, right? Nike doesn't make shoes unless there's a demand. It's supply and demand. So the more veterans that use it, the more it helps other veterans. You could be that reason that the VA hires another doctor or a nurse, or maybe that's the reason they need to build another wing of a hospital. And that helps more veterans as long as we're using it.
Right. That's interesting. So myth number 3 about VA healthcare. I am automatically enrolled in VA healthcare once I receive benefits from VBA.
Yep, this is another one that we hear a lot. We hear it a lot from family members of veterans as well. So the VA has 3 different parts: the Veterans Health Administration, which is the hospitals and clinics, and then it has the benefit side, which a lot of people see as the home loan guarantee or the GI Bill, or disability payments. So those are kind of the big ones out of there. And then there's the cemeteries. So we have the big one in Bourne that covers all in New England. And obviously there's the state benefits and the state cemeteries as well. But a lot of people think that if they use their GI Bill, for example, when they came out of the service, that automatically puts them in the VA healthcare system. And it doesn't. So there's a lot of different reasons behind that. A lot of it's that, you don't want your social security number running around everywhere. So every benefit's a little different. So you apply for them. So you do need to apply for VA healthcare. And it just, it's one of those things that it is, the eligibility requirements are different for each person. So you have to still apply for the VA healthcare system, even if you're receiving benefits or you've used the benefit from the Veterans Benefits Administration in the past.
And what in the case, I mean, for a lot of veterans like myself, I was referred by VBA from the Veterans Benefits Administration to the VA for a medical appointment for a compensation appointment. And so I was seen by a VA doctor,
Yeah.
but that only happened because it was part of a claim. So for veterans that are going to the VA for CMP exams, does that make them automatically enrolled?
Nope, it doesn't. That's another one that we get a lot. So a veteran will tell us, "Oh yeah, I've been to Jamaica Plain. Was when I put my claim in 30 years ago." Really, if we hear that, we ask the veteran if they've been in the last year or two, or to name their primary care doctor. If the veteran can't do either of those two, they're probably not in the VA healthcare system. So then that's when we try to enroll them into the VA healthcare system. And we can check and see if they are as well too.
Okay. The fourth myth for VA healthcare is I only served in the National Guard or Reserves, so I'm not eligible for VA.
Yep, that's another big one we see, especially in New England, where we don't have a gigantic active duty base in New England. So we do have a lot of guardsmen, a lot of reservists, especially from the last 20 years from wars in Iraq and Afghanistan. A lot of those people were used and called up. So they will look at their active duty time, and that can make a veteran eligible. If they signed up as soon as they came home from Iraq or Afghanistan, that makes them eligible as well. And then, of course, if they have a service-connected injury, that would make them eligible. And if they're at risk of homelessness or maybe under the income requirement, those are other factors that could be. Just for the plain fact that you are in the Guard or Reserve does not make you ineligible for VA healthcare.
So it's kind of like along the same guidelines of myth number one, whereas every veteran has a unique situation.
Correct.
And regardless, they should probably just go ahead and apply.
Yeah, I tell people don't stop until you get it in writing from the VA that you're not eligible, because that's a lot better of a resource than maybe what the person at the VFW bar is telling you.
All right. The fifth myth of VA healthcare is if I'm receiving VA benefits, I'll lose my drill pay from the National Guard or Reserves.
That's not the case for VA healthcare. So if you're actually just coming to the VA healthcare for a primary care appointment, that's not going to dissuade you from being eligible to still serve, in active duty or the Guard or Reserve, or we get that for firefighters and policemen and correctional guards as well. So you can still use the VA healthcare system, and we also have the vet centers, which are also confidential. So there is an avenue that way to have complete confidentiality. Of course, there's HIPAA rules and all that sort of stuff applies at the VA. But there are a number of ways that you can use VA healthcare system that's not going to affect any drill pay or anything like that.
Interesting. Okay. The sixth myth for VA healthcare is I have TRICARE and cannot use the VA.
We hear this from our retirees a lot. Retirees, it's a big benefit that they received for either medically retiring out of the military or for doing their 20 years. So they think that is the only thing that they received out of it, and that the VA is just for veterans that serve 4 years. So there's a lot that think that they're completely all set, because let's face it, they're getting a medical benefit for retiring. So why would you get two medical benefits?
Right.
So a lot of them think that, but when we end up talking to the veterans, we talk about their hearing aids or their glasses, and a lot of times the VA, is provided by the VA is better than what they get at TRICARE, and then they can use it a la carte. So if they want to use some things in TRICARE because they may like their cardiologist or whatever, when they want to use the VA for other things, that's something that's completely doable, completely possible. You just have to have a VA primary care physician. But yeah, you can use both. There's no rules against double dipping or something like that.
Yeah, I've heard from some veterans in the past who use TRICARE or qualify for TRICARE that there are actually certain things that are not covered by TRICARE, right, but they are covered by VA.
Yep. We certainly see that. The TRICARE is not going to give you nursing home assistance and things like that, where the VA does. So that's a huge cost benefit savings for the family if the veteran can use the VA for something like long-term care, where they couldn't get that from TRICARE, but they can still have their family insured under TRICARE and they use the VA. It works completely fine that way.
Okay. The seventh myth about VA healthcare is if I use the VA, I'll lose my Medicaid or Medicare benefits.
Yeah, just like TRICARE, VA can be used with Medicare or Medicaid. We have a lot of veterans who fall into that when they retire. That may make them income eligible to use the VA. So yeah, they think that they can't use both. There's no double dipping rules again with Medicare and Medicaid with use at the VA.
Now, I've heard of some people actually using VA as a supplemental.
Right. Yeah, you can do that
Yeah.
too. Yeah, the big donut hole that everyone talks about.
Let's see here. The eighth myth about VA healthcare is I make too much money to get into the VA system. I hear this one all the time.
Yeah, we hear that all the time. A lot of this comes from the rumor mill. They know that someone else was denied because they made too much money. So that is the last thing that the VA is going to look at. There are different eligibility groups. The VA is going to look at a lot of different things. That's why they ask for your DD 214. So if you have certain wartime service, boots on the ground in Vietnam, and now 8 miles off in the waterways from Vietnam, the Blue Water Navy are eligible for VA healthcare, no matter what their income is. Same thing goes for Medal of Honor recipients, Purple Heart recipients, prisoner of war, former prisoners of war. They're all eligible for VA healthcare, no matter what their income is. Same thing applies for if they have a service-connected disability. They could make $1 million a year. They're still eligible for VA healthcare because they earned it from having that service-connected injury. So that's a big thing that we talk about too, is that these are earned benefits. So the income doesn't matter unless you don't hit all those other criteria. Same thing goes with the 30 days at Camp Lejeune from 1953 to 1987 because the water was polluted. So it's a little different than saying it's earned, but it's deserved because the water was polluted. So those veterans are automatically eligible for VA healthcare as long as they apply.
So to clarify, I could be a hard charger who served in the military. I got 10% disability through the VBA, and I am also the CEO for a bank.
Yep. You'd still be eligible because that 10%. And another priority group is the Persian Gulf War veterans. They're all automatically eligible as well as long as they apply.
Okay. The ninth myth about VA healthcare is I was told I was ineligible years ago, so I can never use the VA.
This one can be very frustrating, because you would think if you were told no, that would be it. But we're a part of the government. Rules, regulations, laws change all the time. And then things are learned, like the water contamination at Camp Lejeune. They didn't know about that immediately. Certainly the effects of Agent Orange weren't known immediately. So that's the biggest group we see are the Vietnam veterans who may have applied in the 70s where people didn't realize how bad things were. They may have been denied then, and then now they're eligible because the rules have changed. Also, income changes all the time. So a lot of times we see it when veterans retire, their income goes a lot lower. That meets the income threshold for where they live, so that makes them eligible for VA healthcare as well. So these things are fluid and can change. It's something that you can call any eligibility office with those questions. You can always just apply again as well.
Yeah, I've personally, I helped a veteran enroll for VA healthcare, and at the time he didn't qualify, but then he ended up being in a motorcycle accident, and he was deemed catastrophically disabled.
And there's humanitarian, needs as well. So that there's a lot of, if you're really down on your luck, could also make you eligible.
Good to know. The 10th myth about VA healthcare is the VA is for older veterans.
We get that one a lot. It's funny, though. You also hear older veterans that say it's just for the young Iraq and Afghanistan veterans, too. So we do hear both sides of it. Kind of goes back to the military mindset. A lot of our veterans are also men, so you have a lot of the feeling of, oh, I don't need that. I'll wait till I'm old and need it. So a lot of people think that it is only old people that are treated at the VA. I can tell you that's not the case. I started using VA when I was 27 years old. There are plenty of younger veterans using it. There are no age criteria. You just have to have that DD-214. So, we could have people as young as 18 technically as patients. So yeah, age does not matter at all. What they look at is on your DD-214, overseas service, Purple Hearts, prisoner of war, Medal of Honor, things like that. They look at your income. They look to see if you have a service-connected disability. All of those things, Camp Lejeune, Persian Gulf, boots on the ground in Vietnam, all of those things are what they look at, and it's not age at all.
Okay. The 11th myth, this is a fun one. The 11th myth about VA healthcare is the VA has second-rate doctors.
Yep, we have heard this one many times over. I think one of the reasons it could be said is because the VA is the biggest teaching hospital in the country. So there's always, especially in New England, every Ivy League medical school, a lot of the big-time medical schools like BU, they all have doctors doing residencies at the hospitals. So maybe that's where it comes from. People may think it's the government, so it's the lowest bidder. I can tell you as a patient, not even from my job, just as a patient, it is not second rate at all. You're going to see some of the best healthcare available. The VA was instrumental in making a nicotine patch. They were a big piece of hearing aids. So what I would tell people is just try it, and you'll find out that it's not second rate at all. Another thing that I tell a lot of people about is Dr. Ann McKee. Dr. Ann McKee she's basically the leading neurologist in the world on CTE, traumatic brain injuries, things like that. If she's in the Time top 100 list. So if you ever see anything, she's been on 60 Minutes, anything about the NFL and CTE, anything with NHL, Major League Soccer, and brain injuries, she's the leader, the leading doctor on all of that sort of information. VA has a gigantic brain bank that they share with BU, and that's how she does most of her work. Because let's face it, CTE and brain injuries has been something that has kind of only been talked about for a decade in the public. The VA has been dealing with blast victims for a long, long time. So the VA has a lot of that information, and they're sharing it to try to figure out the best cures for these things. And you'll see her all over the place. So yeah, the VA with second-rate doctors and equipment is not the case at all.
Yeah, the amount of research and stuff that VA New England itself does is just bonkers. And then the amount of stuff as far as grants and what have you, the amount of support that they provide to all these different organizations that are outside of the VA to get stuff done is even larger. So there's a lot of good work that's being done by the VA and its doctors. Myth number 12, the final myth. The VA has substandard hand-me-down medical equipment.
Yeah, also not the case. I'll as a patient, I've certainly seen these. The first time I ever heard of EEG was at the VA, and that's a brain test that they hook up a bunch of different things on, like 80 different sensors, and they've got strobe lights and all this other stuff going on. They're tracking your brain, how your brain functions. Never mind the fact that I've received MRIs, CAT scans, all that sort of stuff, same day. It's faster in the private sector. So I certainly can tell you as just a patient that you're not going to see any second-rate stuff like that. It's only world-class and best care possible for veterans.
It's also, I've been told that it's also big part of the reason why we have such great relationships with teaching hospitals and all that kind of stuff, because we have such good equipment that they're they want to be there to train on it. So, all right. Well, Kyle, thank you very much for coming in, covering the 12 different myths about VA healthcare. And I have to have you back sometime.